Hello everyone. Welcome to our video on the different heart attack symptoms between men and women. Heart disease is the leading cause of death for both men and women worldwide, but did you know that heart attack symptoms can vary between the two sexes? While chest pain is commonly associated with heart attack, it may not always be the case for women. In fact, women may experience different and sometimes subtle symptoms that can easily be mistaken for something else. In this video, we'll discuss the unique heart attack symptoms women may experience and provide tips on how to recognize and respond to them. We hope that by sharing this information, we can help to save lives and raise awareness about the importance of heart health. And guys, thank you for watching our content. If you found it informative and engaging, we kindly ask you to consider subscribing to our channel. By doing so, you'll be the first to know when we release a new video, and it helps our channel grow and helps our community grow. Your support means a lot to us. So can I get just one of you to give me a subscribe this video? Just one of you, just give me a subscribe. And with that being said, let's get started. Jennifer was thrilled to bring her first child, Brian, home from the hospital when she was 28 years old with her husband, Adam. On a blog she created following the birth of her son, she wrote, "When I think about the first week with Adam and Brian home, I can't help but think that the world is trying to show me every lovely, flawless element of itself." She anticipated using her maternity leave to get to know her newborn and indulge in the foods she missed while pregnant, such as wine and cheese. Instead, she had a sudden coronary artery dissection and subsequent widowmaker heart attack 8 days after becoming a new mother. She claims she always put her health first and has no family history of heart disease. She ate a balanced diet, exercised frequently, and kept her weight in check. 8 days after giving birth to her baby, she suddenly had severe, painful pain in the middle of her chest, her triceps and the back of her arms and in her back. She was terrified and had no clue as to what was going on. It felt like I was being stabbed in the chest, getting my flesh torn off my arms, and getting my back bashed in with a baseball bat at the same time. The agony was so excruciating that I kept forgetting to breathe and holding my breath. Her husband brought her to the emergency hospital, but for several hours the medical staff there didn't even think she was experiencing a heart attack. A young lady of color I was. Despite having the typical heart attack symptoms, I didn't match the profile of someone having one. And as a result, I endured hours of agony while being treated for my worry over becoming a new mother, the woman claims. A cardiologist immediately scheduled her for emergency surgery, which eventually saved her life when an ultrasound indicated that she was in critical peril. Years have passed since her heart attack. Even years later, she claims, life has not and never will return to normal. For the rest of her life, she must take medicine, maintain a heart-healthy diet, and exercise often. She claims that she fears about having another heart attack every day. It's a trauma, yet she is happy that she has a second child and that she has been able to watch her son grow up. She thinks that it's important to educate women of all ages about their cardiac risk factors and preventative measures. Reducing the amount of stress faced as a working parent and safeguarding time for relaxation was for her the largest lifestyle shift. She is unsure of the exact reason of her heart attack, although it might have been linked to the hormonal changes she went through while pregnant. People of all ages should be aware of the warning signals of a heart attack and the risk factors associated with them, since heart attacks are becoming more common in younger people, especially women. How do you recognize a heart attack? While some people can feel an elephant pressing against their chest, some heart attack symptoms are more mild. According to Dr. Jamal Rana, Chief of Cardiology at Kaiser Permanente in Oakland, California, there is a wide spectrum of symptoms that make it challenging to diagnose a heart attack. He says that although chest pain or pressure is the most typical symptom, discomfort in the jaw and arm might also occur. Often signs of an oncoming heart attack include feeling tired, short of breath, or nauseous. According to Rana, heart attack symptoms are the same in both young and old persons. Younger patients, on the other hand, may not take them as seriously or think of their symptoms as prospective heart attacks, he says. Delays in therapy may occur as a result, which may have negative effects. Do women have distinct heart attack symptoms? Women may suffer symptoms that are dissimilar from those experienced by males, which can further make it challenging to diagnose a heart attack in a woman. For women, common symptoms may include lower chest or upper abdominal discomfort, a sense of indigestion or exhaustion, in addition to the more frequent symptoms of chest pain, explains Rana. Women tend to wait longer to seek care since many of these symptoms might be mistaken for other ailments, he claims. Why are there more heart attacks in young people? According to Rana, the number of young individuals experiencing heart attacks is rising due to earlier development of diabetes, high blood pressure, high cholesterol levels, and smoking or vaping. Dr. Mary McGowan, co-director of the Lipid Clinic at the Dartmouth Hitchcock Heart and Vascular Institute and Chief Medical Officer of the Family Heart Foundation, claims that the high rise in heart attacks among younger people appears to be caused by an increase in obesity, sedentary behavior, and poor diet. She continues by pointing out that genetic problems are another important cause of heart attacks. Younger individuals should speak with their family members to learn about the history of their family's heart health. So that they may undergo screening, alter their lifestyles, and begin taking preventive medicines before suffering a heart attack, according to McGowan. Indigestion, muscular pain, and panic episodes can all be indications of heart attacks. Because heart attack symptoms sometimes resemble those of other illnesses, McGowan notes that patients who are undergoing a heart attack frequently assume they are having indigestion, muscular pain, or even a panic attack. A person may believe they have the flu when severe weariness is a primary symptom. Since experiencing her own heart attack, Rachel has urged other women to believe in their bodies. Advocate for yourself if something doesn't seem right, she advises. Rachel continues by saying that although she was fortunate to have survived, no woman should have to rely on good fortune to go through a heart attack. Thanks for watching, thanks for subscribing, and I'll see you next time.